Good morning, everybody. My name is Dr. Eric Herman, aka Guru Chiropractor. This is patient Francesca. Hi, Francesca.
Hi.
Good morning.
Good morning.
She's here to get some problems evaluated, and I'm going to let her explain in her own words what's wrong and what's bothering her, and then we're going to roll right into. I'm going to do an exam, so I want you to see how I examine and find the problems and diagnose, and then also hopefully, because this is just we're rolling with it. Hopefully, give her some good results. So tell everybody what's going on and why you're here.
Sure. So my right shoulder and my right side is my dominant side. I started getting pain in it when I was doing tricep dips, when I was doing lateral raises, especially on shoulder day. And then I started noticing that it was noticeably getting weaker. When I was lifting weights, free weights, typically, I could not even raise the weight as high as the other side. So that being my dominant side, I knew something was going on. So I'm really excited to check it out.
Got it. Cool. And we talked a little bit before, but just for the sake of the audience, you didn't really have an injury in that shoulder that you're aware of.
No.
It could have still been injured and you're not aware of it, possibly.
Right.
But also, it could be coming from, which I'm suspecting, but I don't know for sure, I'm going to check, could be coming from the neck being out and causing a pinched nerve here, which goes into the shoulder and then causes secondary problems in the shoulder. So that's what we're going to try to check out today and determine, is it the shoulder, is it the neck? Because if you can't find it, you can't fix it, folks. Let's put it that way. So first and most important is you got to find out what the problem is. Okay. So, come on over, sit here now, just square off, kind of sit forward. Right. I'm going to come behind, just do quick hands-on. Sorry, my hands are cold. 23 degrees this morning in New Jersey. Yuck. That's an indicator that there's something wrong in the neck, and it could be causing that pinched nerve going down into the shoulders. If there's a pinched nerve, you could have pain and symptoms, traveling pain, nerve pain, things like that. Sometimes you can have a pinched nerve and no symptoms whatsoever, but the function will always be limited wherever that nerve's going to. So when we're dealing with a muscle, we're going to look for strength. Is it normally strong or is it abnormally weak? Okay, so I'm going to do some muscle testing. So first thing I want you to do with this side, actually we're going to check both sides to compare.
Okay.
I just want you to bring your arms out parallel, and I'm going to push down.
Okay.
When I do your best to resist me. Don't let me push.
Okay.
This is checking the medial deltoids. So we'll start on this side and push up. Okay, good. So you feel how that contracts and locks?
Yeah.
That's a healthy contraction. Everything's going good on that shoulder.
That makes sense, because that shoulder feels good.
Yeah. You could rest that one.
Okay.
Now we're going to try this side, so push up. And also a healthy contraction.
Okay.
Is there any pain when I pushed?
No.
No. Okay. So now we're going to change to a different muscle, or actually a different aspect of the deltoid. We're going to check the front deltoid or the anterior deltoid. So bring your arms straight out in front. And again, don't let me push down. Okay. So since I'm here, I'll just do this side. Push up. And again, that's healthy. No pain?
No.
Okay. Push up. Okay. Healthy contraction. That's good. One more time here. Palm up. That changes things. And again, don't let me push. Ready? Resist. Uh-oh. See what happens?
Yeah.
You don't have that distinct locking.
Yeah.
And it kind of goes whoa, down.
Yeah.
Try this side. Push. See how that stays locked?
Yeah, that's crazy.
So relax. There's definitely something going on right around here.
Yeah.
Possibly AC joint, but I don't know. I'm going to double check that. I'll write that down later. So next thing I want to do is check the rear here. These are the trapezius muscles and the posterior deltoid. So again, bring your arms out, right? Palms facing me now. And I'm going to pull forward.
Okay.
Don't let me. Let's try on this side first. So I'm just going to pull forward. You resist me. Ready? Good. Bring it down a little lower. And again, don't let me pull forward. Good. Relax. That's the trapezius muscle, the lower part here and here. Let's try this side. Again, don't let me pull forward. Resist. Okay, so that's got nothing.
Yeah.
You can't even hold it locked. Is it pain when I pull or
no,
just...
it's not pain, it's just weak.
Okay, again, hold. Yeah. So now we isolated a muscle. Bring it down a little more.
I'm trying really hard.
Right. It's not because you're... I'll explain. Let me check one more thing. All right, hold. Yeah. It's not because there's the muscle is damaged, I don't think. I'm really thinking it's a pinched nerve here, and then it's not getting enough nerve energy into the muscle because your whole body needs energy to function, including the muscles. You need energy to squeeze and contract your muscles. If you're not getting enough through the nerve supply, you're not going to be able to contract properly and hold that contraction in a solid way, right?
Right.
The cool thing is that means there's no damage really here. We just got to restore the energy flow to that area, and most of the time, instantaneously, normal strength or better strength comes back.
Yeah.
So there's a few pressure points, and there's also some points on the spine where the nerves come out and go to the shoulder. Then I'm going to kind of test. This is like a test or what's called a challenge. I'm going to do a little mini treatment on those areas to hopefully give a little relief. Then I'm going to come back and recheck the function. If function comes up, that tells me, guess what? Bullseye. I'm on the right spot. It's going to get good results, and now we got to do more treatment there, right? So before I just try stuff and then send you home and bring you back, we can actually confirm right here, right now, whether the treatment's going to work or not before we even go further, right? Pretty cool?
Yeah, that is really cool.
All right, so for the trapezius back here, it's kind of in the middle back area, like right about here. I don't know if, is this soreness?
Yeah.
Okay, so I'm just going to rub. If it's too much and you need me to ease up, just let me know. Sore?
Yeah, but bearable.
Bearable, okay.
Actually feels kind of good.
Good, okay. Well, that's good. All through here. All through there, right? And then I'm also going to rub a little bit in the cervicals and the neck where it was sore. And again, this is not a full treatment. It's just a little mini treatment to remove some of the tension and hopefully get some more energy flow going down into the shoulder, hopefully. Okay. Now, bring it out again right here. And again, don't let me pull forward.
Okay.
Push back. Okay. You tell them what just happened.
Oh my god. I got my strength back.
So
that's crazy.
Isn't that pretty amazing?
And I was really trying before too. I was like really
Right. I've seen this hundreds, maybe thousands of times where the patient's like, their brain's going, I cannot compute. How did that happen with just one little row? Well, we're removing some energy blockage to the flow coming down. And that's really, sometimes all you need to do is like flipping on a light switch.
Yeah.
Okay. Do this again. Remember this one was weak? The palm up. And let me check this one. Hold it. And look at that. Is there less pain when I'm pushing down? Or was there pain? I forgot.
There wasn't pain, it's just weakness.
Got it. Another thing is possibly here. I don't know. Is that sore?
Yeah.
Okay. I'm going to just, sometimes you get a little separation in the joint there. I'm going to just do a little thrust together. And then also sometimes it can get like jammed.
Yeah.
This is a fun one, guys. I get to punch my patient. It's a little bit of a thud. Like this, just to unjam the joint in there. You okay with it? That never hurts. Nobody ever complains that it hurts.
I trust you.
Okay, relax. Just relax. One more. Good. Bring it out again, and let me just see. Oh, I can do pull-ups on that arm.
That's crazy.
Isn't that great? Okay, so that to me, folks, gives me extremely high confidence that I've made a bullseye on my initial diagnosis and where to treat and how to treat it. So now I'm going to go ahead and do a full treatment, and I expect really good results. So go ahead and lay down on your stomach, face down.
Should I put my hair up so it's out of your way?
You could, although I could work around it. I work around hair.
Okay.
But I might mess it up. I'm not a hairdresser, so.
Oh, that's okay.
Cool tattoo.
Thank you.
Alright, so basically the rubbing was like a pressure point treatment. Now I'm going to do an adjustment on that exact area, and the adjustment really opens things up and really sort of locks in the treatment. Okay, so the first thing is I'm going to release the neck in that area. So you're okay, right? Okay. Lift up your head slightly, tilt your head sideways. Just relax it. Awesome. Did that hurt?
No, it's just the sound.
The sound, you don't like it, right? Alright, breathe in. That's the sound of healing. Blow out. Relax. Beautiful. That went pretty easy.
Yeah.
And again, deep breath in, and then exhale. Good. Got it. Take a deep breath. Just relax for a second. Just because you're there, I want to do both sides.
Okay.
This is really the problematic side, but there was some tension here, so I'm going to release this side too. Just look straight up, tilt, and relax. Good. Awesome. 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 A little bit more. Breathe. Good. Sorry, I beat you up on that one. Let it go. Good. All right. So, for the sake of this particular condition, I'm going to stop there. I want you to get back up and sit back up again. Kind of move your shoulder around, kind of move your neck around. Tell me what you notice that's different than before the treatment, if anything.
I feel like less pressure in my neck.
That's a good sign. Because pressure, or what's called compression, is usually the main cause of pinched nerves and neck going out of whack.
Yeah, I almost feel like it's a little more flexible, kind of.
Yep.
Like
A lot released. I don't know if they heard that, but that was a big pop, right?
Yeah.
Okay. So feeling better is good, and not always do the symptoms go away right after the first visit. But if the function comes back, I know it's just a matter of time and maybe a few more visits, and then the symptoms are going to start to go away too.
I can't believe you did
Let me
that
double
that
check.
fast.
Let me double check.
That's just unbelievable.
Hold here. Look forward. Press backwards. Good. Yep. And press backwards. Good. And this one, pop up. Push up. Okay. That is a successful treatment.
Awesome.
And I don't know. You might need some more treatments. This might not. This is what you need, but it might not hold. You know, it's not stable yet, maybe. As soon as you get active and a little stress, it might start to drift back out again.
Okay.
If that happens, come back for a few more visits to really lock it in and help it get stabilized.
Okay.
And then everything should be better.
Should I start like low weight and work my way up? With the shoulder?
With working out, you mean?
Yeah.
Yeah. What I would do, my best recommendation is to maybe take like 1 week off of doing the shoulders.
Okay.
Just let it completely rest.
Okay.
Rest your body as long as you're not stressing out your neck while you're doing other lifts, then that's okay. But just take a little time off so that can start really heal, and because working out is good for you, but you're really stressing the body when you work out. So you don't want to put any extra stress in there for about a week.
Okay.
And see what happens.
Thank you.
You're welcome. Good job. Good job.